Hey, I'm Dr. Paul, and today I'm going to show you how to inject yourself with your Mounjaro pen. The first thing you might want to do is watch the whole video and then come back and watch the video while you do it, so you understand all the steps. If you're injecting yourself for the first time, you're probably a bit apprehensive, but don't worry, it's not as hard as it sounds. So first you need to sterilize the top of the pen. Pens can carry bacteria, particularly if you've had it for a couple of weeks. So you need to make sure you use an alcohol swab, which you can usually pick up in your pharmacy, to clean the top of the pen and make sure there's no risk of infection. Remember, you'll have to do this before every time you use the pen. Next step, you need to put the disposable needle on the pen. Tear off the cover and then place this onto the needle. Twist it until it secures tightly. Your disposable needle usually has 2 plastic covers on it. Now that the needle is tightly on, you need to remove these 2 plastic covers and put them aside because you'll need them later. Next step is to clean the area that you're about to inject. There are several areas you can inject, but the most common 3 areas are the outer upper part of your buttock, the abdomen on the lower tummy just below your belly button on either side, and finally in your thigh. What you need to do is clean this site and remember exactly where you've cleaned because this is where you're going to inject. Now we need to prime the needle. That means remove any bubbles before injecting. To do that, you need to turn the dial 2 clicks and then point the needle upwards. Give the syringe a flick and that will move any bubbles towards the top. Push the plunger all the way down. You should see a little drop of product coming from the top of the needle. Make sure you press fully so that you get the dial back to 0. Now you're ready to inject. You'll probably want to have a tissue aside because after you pull the needle out, occasionally there can be a small bit of blood that you might want to press for a couple of seconds. Now you need to select the full dose, so twist the dial all the way up to the number 1. Locate the area that you've cleaned and now push the needle into the skin or get someone else to help you to do that. Once you've put it into the skin, now press the plunger all the way down until you've administered the full dose. You'll know you've administered the full dose because the dial will return from 1 all the way back to 0. Now that you've finished your injection, you'll want to dispose of your needle. This is where the plastic cap from earlier can be useful. Carefully place the cap on top of the needle and you can use that to unscrew the needle and then safely dispose of it in a sharp spin. Put the cap back on the pen and store your pen in the fridge for next time. Keep this video as a reference to remind you exactly how to do it until you become comfortable doing it regularly.